Good afternoon, everyone. Thanks for joining myself, Sophie Parrott, a journalist at HR Grapevine, today for an HR Grapevine and Generali webinar titled Identifying and Managing Stress Among Your Global Workforce. With a wealth of research indicating that workers are feeling more and more stressed and anxious than ever, it is crucial that organisations have a concrete understanding of how to identify stress, how it can manifest at work, and which tools are available to help employees curb stress both at home and at work. This webinar will explore stress and mental disorders and how each can manifest in the physical body and the impacts on individuals at home and at work. It will also explore how these conditions can be supported and addressed in the workplace to help employees improve overall mental health. I'm joined today by Jason van Schie, Managing Director at People Diagnostix, Dr. Juliane Sachschal, Mental Health Programme Development at Generali Health Solutions, and Daniela Masters, Head of Global Health and Wellbeing Programmes at Generali Employee Benefits, who will all elucidate further on the subject. Today's webinar will be organised and presented in 3 short sections to help us properly discuss each topic. Throughout the duration of the webinar, please use the question function to put forward questions to the speakers, and I'm sure they will be happy and able to answer at the end of the webinar. Without any further ado, we'll get started on the first section of the webinar, which explores the impacts of stress on workplace productivity and how stress can manifest in unexpected ways. So for this section, I will be joined by both Jason and Juliane. Welcome.
Hello.
So, I guess the first question to start off with is, could you perhaps tell me a little bit about how we tend to view mental versus physical health and how that impacts care and support for mental health?
Yeah, thanks, Sophie. So I've been working with workplaces in this space for many years now, and occasionally I'll go in and I'll run a workshop. And one of the first questions I'll ask them is, when you hear this term mental health, what are the first things that come to mind? And usually in these groups, they'll say things like depression, anxiety, and stress. Some groups might even say things like schizophrenia and psychosis, which is really interesting because they're automatically jumping to illness rather than wellbeing. And it's particularly interesting because if I gave you the term physical health, you wouldn't automatically jump to cardiovascular disease and diabetes straight away, would you? So I think as psychologists, we do actually have to take some of the blame for this. We've been trying to destigmatize the term mental health for many years, but I think we've been going about it largely the wrong way. You see, psychology traditionally is always focused on the identification and treatment of illness, not so much staying well and optimizing well-being. We're a long way behind where physical health is. I mean, if you think about physical health, everyone knows the pillars of good physical health. There's 5 of them. What are they, Sophie?
So I can give you 4 off the top of my head. So we've got obviously diet and nutrition, sleeping, exercise, and not drinking too much alcohol as well. I think are probably 4 of the salient points. Am I right?
Yeah, I'm glad you added not drinking too much. So we're allowed to drink, but obviously drinking in moderation.
In moderation,
yes.
Everything in moderation.
And the other one is not smoking. So when we do those 5 things for our physical health, not only are we less susceptible to disease, but we can also optimize our well-being. Now, lesser known are the pillars of good mental health. We can use the acronym PERMA to remember these. So PERMA stands for experiencing positive emotions like awe and love and gratitude and hope, all those nice things. Engagement, or the experience of flow, when you're completely absorbed in an activity that you completely lose track of time, you become really focused and productive. Positive relationships are important, having a sense of meaning and purpose, and then having satisfaction from accomplishment of meaningful goals. So like our physical health pillars, the better we do in those mental health pillars, the less susceptible we are to illness, and the more likely we are to flourish and reach an optimal level of well-being. So in short, I think we're a long way behind where we are when it comes to physical health, but I think we can catch up.
So I guess then, in order to better define the terms that we use, could you perhaps talk a bit about the difference between stress and mental disorders and sort of like mental illness? Perhaps Juliane, if we start with you.
Yeah, thank you, Sophie. So I'm going to go back now to more the illness-related topics of mental health. And so when we were planning this seminar, we thought it's really important to talk about the differences, or making clear what are we actually talking about when we talk about mental health. And so as Jason just said when he asked people the question what they think about, they think of stress, anxiety, and depression. And I think this really shows that quite often we just mix all these things in one pot and we don't really think about what we actually mean. So do we mean stress, or do we actually mean mental disorders like anxiety disorders or depression or even schizophrenia? And so when we talk about stress, stress is not necessarily negative. It's actually an adaptive reaction. It's basically just a physiological and psychological response to external or internal stimuli, and it really depends on the individual how they can deal with it. So that if they have enough resources to deal with these stressors, then they can flourish. But if they don't, then they will feel stressed. And this can be just a short-term thing, or then of course if the stressor keeps on and the person doesn't have enough resources, then this is chronic stress, and this can be really damaging. Mental disorder, on the other hand, really means a pathological change in the perception, thoughts, behaviors, and feelings of a person, and which holds on for a certain amount of time. And of course, this, like if a person suffers from a mental disorders, they should seek treatment. So yeah, I think it's really important to always think about, are we actually just talking about stress, or are we talking about mental disorders, and really making the difference there.
So I guess if we take it back to the beginning, how does stress and poor mental health actually manifest in the body to begin with, Juliane?
One second, sorry, I was just muted. Yeah, so of course, what happens with poor mental health is that it's not only a psychological thing, and also you can, it also manifests itself in the body. And in general, you can say that, there is a close relationship between physical conditions and mental conditions. And you can really see that chronic stress really leads to physical health conditions such as cardiovascular diseases, strokes, but also things like irritable bowel syndrome or other physical conditions. And I think Daniela is going to talk about this a bit more later. What is important to say, though, is that there is not necessarily a causal link, but it's just stress increases the risk for this sort of physical things. And what we can say about mental disorders, that physical problems are often part of the symptoms, really. So you often have people having sleep problems, which, for example, 80 or 90% of people who suffer from depression actually have difficulty sleeping. You have a very high arousal in the body. You often suffer from pain, such as headaches or back pains. And also people quite often report dizziness. And what is interesting is that because mental health problems often still are stigmatized, or people can't really place them, so often when people go and seek help, they actually seek help for the physical problems they have. So they go to see their GP and they say, I have constant headaches, or they say, I feel really sleepy, and I feel dizzy. And so it's sometimes really hard to differentiate whether that person just actually has a physical problem, or whether there might be a mental health problem that lies behind that. So, but what we can see is that it's much easier often to talk about these physical things than talking about mental health. And I think what is important, again, not everyone who has back problems does have an underlying mental problem. But we should be aware that with certain physical conditions, first, mental health problems or mental disorders especially are more prevalent, and also that there could be something behind that. And especially if we don't pay attention to that, and often also the GPs don't necessarily have time to ask all these questions about mental health, so they really go unrecognized for a very long time. So people suffer from anxiety disorders to up to 8 years until they actually get diagnosed and get treatment. So I think that's a really big problem. And so what we're thinking, or what we're trying to do, is to think about how we can actually use these physical problems that manifest themselves, you know, to make people also aware of their mental disorders, in case, you know, there is something, but, you know, to use it basically as an entry to talk about mental health.
So I guess when sort of thinking about the triggers, how do these conditions, you know, sort of stress and mental disorders, how can they actually manifest in the workplace? Perhaps, Jason, if we start with you.
Yeah, sure. Well, first of all, stress is a leading cause of absenteeism. So if we use the UK as an example, out of the 30 million days of lost work due to injury or illness last year, about half of that was due to stress. There will be more recent data coming out, or current data coming out the next week or two on that. But not only do people necessarily take time off work when they're stressed, they can also come to work but not be fully present. And we call that presenteeism, obviously, being at work in body but not in mind. And then that obviously leads to decreases in productivity, lower levels of engagement. And because, like Juliane was saying, there can be this influence on sleep. People come into work and they're tired and they're grumpy, and you know that can then lead to negative relationships with their peers and impacts on the work group culture as well.
And Juliane, do you have anything to add to that?
Yeah, so maybe just talking a bit more about mental disorders, because we want to kind of make this distinction. So I mean, the problem is very similar, but with mental disorders, you really see the huge productivity losses that there are due to mental disorders. So the World Health Organization recently estimated that there is like $1 trillion per year lost due to mental disorders for the economy. And when you look at the numbers, you can see that 1 of 5 workers throughout their work life will experience a mental disorder. So it's really, or like a clinical significant mental disorder. So it's really something we shouldn't overlook, and it's really something we need to do something about. And also in the public health debate, more and more people recognize that the workplace really is a place where we can reach people and where we can do something about mental health, and that we shouldn't, you know, leave it to the people at home. And yeah, the same as with stress. In Germany, there has been a recent report that 17% these days of sick leave of days are due to mental disorders, and this makes it the second most prevalent cause for sick days of employees. So yeah, this really shows how important that is. But one thing I really care about, or what I think really matters, is that most people actually still work even if they have a mental disorder. So for example, with depression, 7 out of 10 people, they are still at work and they can work, but of course there might be some difficulties that they are experiencing at work, and actually the costs of presenteeism that Jason mentioned are estimated to be 2 to even 10 times higher in mental disorders compared to the sick days or absenteeism that is caused by mental disorders. And so I think what is important to see in the workplace is that that people who are suffering from mental disorders, you know, they to recognize them or to offer them help. And you know, they often you can often see it in changes of behavior, basically, so that people, you know, feel sleepy, tired, they struggle to motivate themselves, they might be often sick, they might struggle with their workload, sometimes they leave early, but they also might stay late because they struggle to finish their work, because usually they really, you know, want to work. And they have problems with their mood, maybe scared about taking on new tasks. And so what I want to say is that it doesn't, you know, that we should be aware that people might suffer from a mental disorder. And just if we see changes in behaviors in people, just to be aware that there might be an underlying problem. It's not always like that, of course. You cannot never diagnose anything, but you should be aware that mental disorders are very common, and that you know, these things happen quite often.
And it's interesting, really, from the statistics that you just mentioned then, it really highlights the prevalence of, you know, mental health and the impact that it can have on you know, an employee's productivity and also on the business as well. So it's really, really important that businesses are doing everything that they can to try and support their employees. So with that being the case, Jason, could you perhaps give me an example of how stress or mental disorders have kind of like manifested in the workplace environment and what has actually been done to address this?
Yeah, sure. So as you can probably tell from my accent, I'm from Australia. I live in Perth, Western Australia, and it's kind of a big mining town, if you like. We have a lot of resource oil and gas companies that have headquarters there. And recently there was a parliamentary inquiry due to a number of suicides that were happening when people were working remotely. So people working in the northwest of the state, hours away from their homes, they might go up there for 2-3 weeks at a time, and then maybe come back home to Perth and be there for a week or so. But there was a lot of concern because people were suiciding when away, and they wanted to get to, you know, what was the root cause of this and what could companies and individuals do to address this. And what ended up happening was there was a series of recommendations that came out of that inquiry, one of them being that there should be a code of practice for fly-in, fly-out work, remote work, and mental health. And what the big push in that code of practice that was just published earlier this year is for companies to take responsibility for work-related stress and the impacts that it has on employees, particularly about how they can take a risk management approach, identifying the sources of stress at their root cause and then mitigating them. And I'll be talking about that a little bit more in the next section.
Okay, great. Thanks, Jason. So we're just going to do a quick poll now, just to find out whether your company is kind of creating an environment that is wholly supportive of, you know, promoting mental well-being. So everyone should have the poll on their screen at the moment. I'll just give you guys about 30 seconds or so to cast your votes. Okay, brilliant. So we've had about 80% of you vote so far. So we're just going to close the poll and then we'll share the responses on your screen. So as you can see, the question was, do you feel like your company creates a work environment that supports and promotes mental well-being? So the good news is that 48% of you have said yes, 17% of you have said no, and 34% of you at the moment are slightly undecided. Okay, so I'm just going to get rid of that. And then, okay, so Juliane, how does the stigma around mental health in general prevent people from seeking the help that they need at work?
Yeah, I'm actually quite pleased with this poll that almost half of you say that you know, your company supports services or an environment of mental health and well-being. So what we can see though is that about 50% of employees, they would not really tell their employer about any mental health problems they have, and I think that really prevents people from getting help or getting the support they need. So I do think there is still a huge stigma around mental health, and you can also say, you know, you also never know whether your employer actually will be supportive if you have a mental disorder or if you come forward with it. Even though there is a lot of things that an employer can do to support someone who struggles from a problem like that. And I think part of the problem with this stigma is also that people don't really know what to do. So it's really hard for people to start with to recognize that they do have a problem, and even not only to be aware of it, but to, you know, admit to themselves that they need help. And I think it's really important usually for the environment, so is it the colleagues or the family, you know, to talk to the person and actually support them in that situation and you know, encourage them to seek help. But because of the stigma, and especially in the workplace, I think this is really a taboo. So so you know, colleagues and also line managers, they don't really feel confident to talk about these things. So, you know, even if you might see that a person struggles, or you might think, oh, maybe something isn't right, you know, people don't feel like they can talk about it or they can, you know, ask the person, so they just remain silent. And I think that's really it's really problematic, or it's really not sad in a way, because if you actually go and talk to the person, you're not, again, like not saying, I think you have a problem or I think you have a mental disorder, but rather saying either I'm worried about you or I have noticed, you know, that you struggle with your work, or that you struggle with this, or that you behave in a certain way, and, you know, ask open questions about it. You know, there can be a really fruitful conversation that follows that actually can really help the person struggling with a mental health problem. And so I think, yeah, it is really necessarily to raise more awareness about these things, to make people more confident to talk about mental health, and especially mental disorders, you know, to not make it as something that, you know, we shouldn't talk about, that we shouldn't tell anyone. And also, if we offer services, I think to talk about when people use them, to actually talk about it, that they use them and that they are helpful, because quite often, even if people know I should probably seek help, it's really not always straightforward how to access help. And I mean, depending on which country you live in, it might be easier, it might be more difficult, but what you see is that the system doesn't always support people immediately. And so it's really helpful to know, oh, this person struggled with a similar problem, and they did this, you know, they could call this number, for example, if there is an employee assistance program or something, you know, and it's just something, if you talk about it more, you can recognize it earlier, and then also get support early on, which is really important, so that it doesn't chronify.
Okay, brilliant. So moving on to section 2, which will focus on how to identify and reduce sources of stress to help employees, you know, stay well and thrive at work. So I'll be joined again by Jason. So essentially, you know, finding and formalizing strategies that can help reduce work-related stress is not only important for the employee for their individual well-being, but it's, you know, there's also lots of benefits to the business as well. So in that sense, what can employers actually do to help their employees manage their mental well-being in general? You know, are there different support services that they can offer, you know, wherever the employee may be on the kind of the mental health continuum?
Yeah, so as the viewers can probably see on the slide that we're sharing now, you know, mental health is a continuum. It's not just illness or wellness, there's also flourishing. And if you have enough employees in your organization, you're going to have people at all different levels of that continuum. That means you really need to take an integrated approach, which is basically a holistic approach to mental health, where you have services that really meet people wherever they are at on the continuum. Now, I think on the left-hand side, these are the ones that employers are probably most familiar with. And we've kind of talked a little bit about them as well. So things like employee assistance programs, having counselling services available to employees that are accessible in person or over the phone, can be really useful when they're in distress or in times of crisis. Return to work, so similar to physical return to work from an injury, companies do need to make accommodations to people returning to work from a stress-related illness or a psychological injury. And then mental health first aid, so that's more common in some countries than others, but similar to physical first aid, it's training up a number of employees, often line managers or HR people like our listeners are mainly today, to identify when someone's really distressed or at a critical point, and then how to intervene and have a conversation with them. So that's kind of what people are most familiar with. What we aren't as good at doing, we identified in organizations, is the preventative stuff. So how do you actually prevent people from slipping down to that point in the continuum in the first place? And how do you optimize wellbeing and help people to flourish? So in that prevent harm section, there's actually 3 things that we can do that can reduce the risk of people developing a psychological injury. Education is one, and if you think again, if I'm going to use the physical analogy quite often today, but if you think about someone working at heights or doing manual handling, there needs to be some education about how to do that work safely so that they're not putting themselves at risk and leading to an injury and time off work. In the same way, I believe that we should have mandatory training around stress management, so identifying sources of stress and how to recognize that in the body and respond, as well as, you know, the skills to stay well and to flourish. When we do that, we can actually increase literacy in this space and prevent the likelihood that people are going to take time off work. Stress management, people do need to learn those skills. Often people do run these kind of skill building sessions in lunch and learns or sessions that employees can attend. And risk management, which is workplace health and safety obligation, and I'll talk a little bit more about that shortly, the strategies involved in that. But the other thing that companies can do is actually get even further in front of the problem, not just reducing risk, but also promoting wellbeing. And we can do that through appropriate work design. So building into things like autonomy in people's roles, having high levels of support from supervisors and colleagues, thinking about workload and fair distribution of work tasks. You could also think about health promotion. So we talked about physical health promotion using SNAP, and we can also use PERMA if we're looking at mental health promotion. And then the other thing that we can do is take more of a strengths-based approach. And many HR practitioners, I'm sure a lot of your readers and listeners to your webinars would be aware of this. Some of the leading organisations are, going away from purely a deficiency-based approach where they try and find out where people aren't performing well and then remediate that through training to get people to an adequate level of performance. Rather, they're looking at how do we identify what people are really good at and passionate about, and how do we find them more of those types of activities? And when we do that, not only do we, again, reduce the risk of harm, but we can promote high levels of wellbeing and reap the benefits in terms of engagement and productivity that come with that.
Absolutely. Anything to add, Juliane?
Yeah, thank you. Yes, I really like the integrated approach that you just presented. I think is really important. Just one thing I would like to add, just talking about the the little red bit again, the mental disorders, which obviously is a very small amount of the employees that will suffer from a mental disorder. But again, it's I just want to stress how important it is, because it's the people that are suffering and also the people that potentially it causes the highest cost. But also we from Generali Health Solutions, we come from an insurance background, and so what we know from our customers is that the problem is that quite often people, even when they get treatment, they don't really get the right treatment necessarily. So I think it's really nice what Jason put here, like the offers or the services that are there at the moment in the workplace for people to support people who have problems or who have suffering from a mental illness. But I really think there is something, or we really think there is something missing, and that is helping people to actually get the right treatment when they are ill, because the EAP programs, they can't really do that. So they at some point they come to a point where they can't really help people anymore who have mental illnesses and should seek treatment, and so they are kind of on their own. But what we experience in the mental healthcare system is that people often don't get the treatment they should get. They don't get the right diagnosis. So from when you look at GPs, I mentioned that before, is like from people with depression, study shows that only 50% even get the diagnosis of depression, even though they are seeing a GP. And then of these people, only less than 10% actually get the right treatment. So I think it's really important to know there are effective treatments for mental illnesses. And we really should do something about helping people to access the right ones and making sure that they get the treatment so they will get better sooner.
So in terms of risk management, Jason, could you perhaps talk about how the risk management concept can actually be applied within an organisation to help support improved mental health?
Yeah, so risk management is applied in many areas of business, right? Often workplace health and safety will be the ones that will take this up. Basically, there's 4 steps to the risk management process, and the first is to identify hazards. So we all know, again, what physical hazards are, like manual handling and working at heights, trip hazards, that sort of thing, and we're very easily able to observe them. Stress hazards, or what we call psychosocial hazards, are often not as easily able to be observed. So we have to actually get feedback from employees when there is an issue. That doesn't necessarily need to be done in a formal way. That could be done just through conversations with employees. But if you're working in a global organization and you need to collect a lot of data across disparate geographic regions, then things like online surveys can be an easy way to collect that information. The next thing we need to do is to assess the level of risk that's present, the likelihood and consequence that a hazard and risk is actually going to lead to some form of injury. In many cases, we just know that there's going to be a risk there, so we don't need to determine that. So for example, if someone is having to work 12 hours a day just to keep up with their workload, then clearly that's not sustainable over the long term. And so we need to think about how we address that risk and put in controls, which is step 3. So controlling risk is where we use the hierarchy of controls. So many of you would be familiar with a upside down pyramid that looks like this. And it basically, the hierarchy of controls shows us the relative usefulness or likelihood of success of a control addressing the hazard appropriately. So the very first thing we should be seeking to do is eliminate the hazard when we've identified it. Now, in the case of workload, we can't always get rid of work or hire more people in order to do the work. So we need to be creative, and it might just be finding efficiencies in what we do. So for example, meetings is a common thing that sucks up a lot of time. I mean, a lot of the clients that I work with, sometimes 6 to 8 hours a day is spent in meetings, and then they have no time to do the job they're employed to do. So an intervention around workload actually might be, once you've received that information and feedback from employees, is to think about who's invited to meetings, how long meetings go for, having a very tight agenda and that sort of thing. Sometimes, though, we can't eliminate, so we then have to use other controls, so substituting. So for example, it's not a great example, but if you think about a leader who doesn't have very good people management skills, yet a number of people report to them, then we could substitute that leader out for someone who has better people management skill. We could redesign work, so particularly autonomy is a key thing that we want to have in roles. So sometimes people can't necessarily change the way they do work, but you might give them flexibility in terms of when they start work or when they take their breaks throughout the day. Some level of control over their environment is really important in everyone's role. Education is also a control, and like I said, I think that should be a mandatory thing that's provided to all employees in an organisation, because all employees will be exposed to stresses in their role. And then encourage personal change. So again, like through health promotion, what are we doing to get people to practice regular health promoting behaviours, like finding meaning and purpose in what they do, and finding opportunities to savour accomplishments and positive emotions.
So I guess in terms of putting things in practice, who are the key stakeholders in the organisation that need to collaborate to develop an effective strategy?
Yeah, you really need to start at the top. And what I've identified is that, people, HR professionals, safety professionals, a lot of them have the best intentions. They want to make a mark in this area and do something well. But unless you get the board or the C-suite involved, you're not going to get time or budget in order to be able to do these sort of initiatives. And so one of the things that you can look at doing is creating an organisational policy regarding mental health and how it's managed, particularly thinking about more the preventative stuff that we can do, like risk management and health promotion. And also even including things in your risk register as an organisation. Many organisations will have every single risk that you can think of, but they don't actually have psychological risks as part of their risk register. By doing that, you then create greater governance of that risk and greater oversight, and then that then leads to more time and budget being able to be allocated. But we also need health and safety and HR and OD to work very closely together. HSE to really help to do the risk management, so identify and work out when there does need to be controls to be applied. But then HR will often need to be involved in the redesign of work and thinking about, how jobs are actually recruited for and organised. But then finally, our line managers. Line managers have the greatest level of impact on the people who work directly for them. And so what we do through our software products, Flourish DX specifically, is enable line managers to take greater ownership of this, and then have greater oversight of what line managers are doing at an executive level.
So once you've got, executive buy-in, you've got line managers on board who are fully trained on how to respond, and you've got, strategies in place, how do you actually measure whether this strategy is making, good impacts on employee mental health improvement?
Yeah, so objective data is going to be best here, and Daniela will talk about some of the data that they collect through claims data a little bit later on. But you can also, as I mentioned earlier, use survey data to collect, bulk levels of data and employee feedback. So within our Flourish DX software platform, we do have what we call work design survey, which not only looks at the positive aspects of work that help people to flourish, it also looks at some of these common psychological risks like workload and lack of job control and support. By doing that, then you're able to, as a baseline, first of all, you're able to identify the hazards and benchmark, I guess, where you need, or use it as a needs assessment, if you like, to work out where you need to prioritize your actions. But then after a period of time, once you've gone through a management plan on how you're going to reduce these risks, then you could redo that survey and see if the interventions have been successful. So again, you could just be doing things qualitatively through conversations with employees or focus groups, but having that quantitative data can be really helpful in that regards.
So I guess, corporate culture and company culture is always cited as such an important aspect of work life to ensure that, employee mental health is at its optimum. So in that case, Juliane, in general, how can employers really create a workplace environment that is fully supportive of optimal mental health?
Yeah, thanks. So I think Jason already talked quite a bit about what are the factors to good mental health in the workplace. And I think there is actually a lot of prevention work being done already, that really helps. And so one thing I agree with Jason as well is the question of line managers, or the question of management really needing to own this issue, and not just giving it on, saying, okay, there is an employee assistance program, so everyone is just can just talk to these people and we don't have to do anything. I think there really needs to be a commitment, and and so one really important part of the work we're doing is to make sure that people, that the management actually is educated, or knows what they're doing and knows how to deal with it. And and as I said before, open communication and the atmosphere is really important. So I think having mental health as an issue and as something that people talk about on a regular basis is really important. So not only that you talk about it in really bad cases, or when it's in certain situations, but just that it's something on people's minds. So then if something actually does come up, it's much easier to talk about a problem if you actually care about how your employees are, and if you ask them on a regular basis, it's going to be much more easier to also ask them how they're feeling, when something is not going well. And so I think that's really something to keep in mind. And at the same time, again, something that I think is really important to know, that we can do so much, to try to improve mental health of our employees, but that there is, the stress in the workplace, or adapting the workplace environment isn't going to make no one ill, basically. People can still get ill, because people can get a depression even after they're a great life event, so after they just got married or had a really a promotion or something like that. And that's actually something many people with depression struggle with, that they think, well, my life is actually perfect, everything is great, so why do I feel this way? And it's really hard to understand that, to understand that for themselves, but also for their environment. So I think just as an employer, to remember that people who get who have mental disorders or who get sick, that there needs to be some support for them as well, and that we don't forget, to make sure that they get the right treatment. And as I said before, unfortunately, many people don't get the right treatment, or it takes them really, really long to get treatment. And so I think it's really one thing an employer can do is to make sure that people access treatment in a good way.
Okay, so in terms of creating, that support for employees, Jason, could you perhaps just talk a little bit about the flourish model and how that actually helps to support the mental well-being of employees?
Yeah, so at People Diagnostics, I guess we're really keen to address the global issue that is stress and mental illness. And what we've done over the past year or so is been developing a scalable platform, leveraging technology to kind of be more preventative in the mental health space. So definitely about the prevent harm, promoting flourishing angle. But we really feel that mental health and stress in the workplace is a shared responsibility. It's not just the employer's obligations to do something about, and it's not just that we tell employees to manage their stress better. It's really about the two parties working together for optimal outcomes. And so if you look at the model that we've got here, the Flourish DX model, the inner ring is really the main employee's responsibilities. And this kind of ties in with that integrated model of mental health that we were referring to earlier. So yes, we do need to have those services to help mitigate illness. And like Juliane was saying, it's about giving people the access to the right services at the right time for the right issue, not just providing the EAP as a band-aid and something that fix all. Preventing harm is something that companies are going to need to do more and more. Particularly we're finding in Australia and the UK specifically that the regulators are actually getting a lot hotter on this. And I think we're going to start to see some action being taken against organisations very soon who aren't actually identifying and managing stress properly. But then also they can be promoting flourishing. So how are they designing work and recruiting for roles to give people the best opportunities to flourish. And then really the employee's responsibilities, again, like the physical health, people need to be responsible for their own nutrition, exercise and sleep. Similarly, employees should be looking at opportunities where they can experience more positive emotions, leverage their strengths more. They can look at how they can find time for the relationships that are important in life and nurture those, find more meaning in what they do, accomplishment, and obviously look after their sleep. So when employees do those things, then obviously that's going to reduce their individual risk of mental illnesses and psychological injuries and give them the best opportunity to come to work as their full self and really enjoy what they do and thrive.
You really hit the nail on the head there, you know, about saying that employees should be bringing their full selves to work. So I guess it does show a huge responsibility on the employer's part to make sure that, you know, they are creating this environment that they can really thrive and that they're also their mental health is actually supported as well. So thank you, Jason and Juliane. We'll be moving on to our final section where we will explore leveraging medical claims data and identifying stress indicators across an employee population. So for this section, I'll be joined by Daniela, who will shed some light on this topic further. So welcome, Daniela.
Thank you.
So if we just get started, could you just talk about how an organisation can identify risk factors for mental health among its employee population, and also why it is difficult to identify and address?
So we've already heard from Jason and Juliane that there's a wealth of reports out there that we could use for a data-driven decision-making in health and well-being. And this is really what JEB does. We take a holistic approach and we really do that on data driven by data analytics. And yeah, so there's lots and lots and lots of data out there that we could use to make decisions and identify risk for mental health among the employee population. But oftentimes we're just not sure how to access them. We've heard from Jason already that there's a lot of different departments that might be involved in mental health support in the workplace. So sometimes we have to access them from different departments, and once we get them, we might not really be sure how to read them. But I think that kind of brings us to another poll that I was hoping to do, which asks what kind of data resources are you currently using to influence your health and well-being strategy? And you can select several of the ones that are on the screen now. So if you could just take a moment to click on those that you're currently using in your organization. And we're just going to wait another moment until we have some more answers. Yeah, just another second. Okay, so we're just going to have a look at what we're seeing now. So a lot of you said that you have employee engagement surveys, that you have EAP reports in place, that you have health risk assessments or mental health risk assessments. Absence data, the majority of you, and we know that there's a lot of HR professionals who are listening at the moment, so this is probably the one that is easiest for you to access. And medical claim data, only 20%, which is a very, very interesting one to talk about a little bit further on in this webinar. So we see that there's definitely a need to build close partnerships within the organization with different departments to kind of access these different kinds of reports. And as a global insurance company or reinsurance company, JEB really needs to keep in mind when we look at our data that we receive, which is medical claim data, what the cultural background might be in the country that we look at and what the scope of cover might be like. And it rarely comes up that we see any mental illnesses or substance abuse claims in our data. And that's not because the issue does not exist. We know that the issue exists, but it's rather simply because it is not covered under the private health insurance. So it's actually explicitly excluded from the cover. And it also doesn't mean that the local insurer can't administer those claims or anything like that. It's just because the local norms aren't around it, or that the services are unavailable, or there are cultural barriers to actually access these services. And oftentimes it then falls onto the national health system to be deemed responsible for those kind of claims, and that is why we don't see them in the private health insurance. But we do definitely know that stress and mental disorder exist in the workplace. We do know if medical insurance is an employee benefit that is offered by the companies, that it is definitely there, but we don't see it in the data because it's not covered. But we know it drives absenteeism, it drives presenteeism, and it is the cause of a lot of disability claims as well. But we don't see it in the data, and that makes it very difficult to identify.
So I guess the poll that we ran the previous slide, it was interesting to see which resources are currently being used to influence health and wellbeing strategies. And about 20% of you said that you use medical claim data. So unpicking that further, what role does medical claims data actually play in the identification of risk?
So as I just mentioned, mental illness specific ICD-10 codes, so that is diagnosis codes that are specified by the World Health Organization, we don't see a lot in our data just because it is not covered. But we do know that stress and mental disorder, and Juliane was talking about this earlier, does manifest itself within the body if it is left unaddressed. So we do know that chronic stress might manifest itself in conditions, as mentioned, like headaches or IBS or a weakened immune system. It can also exacerbate certain conditions like asthma or an AFib, an irregular heartbeat. And we're trying to focus on medical condition in our claim analysis, that we're trying to focus on medical conditions that can either be influenced or exacerbated or worsened by stress and mental illness. And that hopefully helps us to reveal potential areas of action for the clients.
Okay, so could you perhaps give us some examples of how data can help point an organisation in the right direction to identify and address mental health sort of risk factors?
Yeah, so this is a very new thing that we're doing. We're providing a global dashboard report to our clients that gives information about the claim experience in each country for one client. And we do this in an interactive way online with drill down capabilities. And one thing that we have recently added to our global reporting is a tab that is called stress indicators. And that really is still a work in progress. So we're still learning from the data that we receive in the ICD-10s that we see. As Juliane rightly said earlier, we really need to be aware of the differentiation between stress and mental illness. But either way, we don't see the F diagnosis in our data, and therefore we need to try and address this a little bit differently. So what we have identified are actually a number of conditions with a clear psychological component that can be difficulty managing life, including burnout or anxiety. It can also be conditions that are possibly related to chronic stress, such as back pains and migraines. And then we have conditions that are possibly exacerbated by stress and mental health issues, such as irritable bowel syndrome and acid reflux. So that is to say that we're trying to understand which of these conditions are increasing or decreasing, and are the claimants that we see using more or less services. So just having these cases, and I've put on a slide here with a little overview of data that we see in our reporting, just having these cases obviously does not mean that the population has mental illnesses or stress, because somebody can have IBS or headaches without having a mental disorder, obviously. But if those possible indicators in our data are all increasing or there are comorbidities, then potentially this could be a warning light and could be a sign of poor mental health or stress in the population. So what we want to summarize, this is not conclusive, this is just suggestive. So we're trying to point into direction and find warning lights. And as Juliane already mentioned earlier, we may also not forget that people go to the doctor for a physical illness or a physical condition first, which later on might then be identified to be related to some form of poor mental health, and the coding in the claim is not changed.
So who then is ultimately responsible for managing and improving mental health within an organisation? Isn't this, like a partnership between stakeholders? And if so, how do employers effectively engage with employees to make a positive impact on their mental health?
So really, and I think that it was something that we heard from Juliane and from Jason today, it is really shared responsibility. And historically, the responsibility of staying mentally well has been pushed on the employee. They have to look after themselves. But I think it is really moving towards a shared responsibility between employees and employers, and all stakeholders really need to work together. The education really has to happen on all managerial levels, from executive to team leaders. Juliane earlier touched on peer support, so to take down barriers for people to speak about mental illnesses. And there's also services available or education available for mental health first aiders, which is actually similar to normal physical first aiders, but for mental health. You could have groups of EAP ambassadors who are educated around the EAP that you're providing in the workplace. And I think one of the most powerful things that you can have is actually leaders that are courageous enough to speak about their own experiences with mental health. It's a very powerful way of normalizing mental health in the workplace.
Brilliant, thanks, Daniela. So, throughout the duration of the webinar, we've explored various different avenues for identifying and managing stress. So perhaps if we could just each take it in turns just to kind of summarize, make the key takeaways from today. So perhaps if we start with yourself, Daniela.
Yeah, I think from our end, it is really about identifying the issue by using the data from the different areas that you have available in the business, and to consider medical data even if the cover does not extend to mental health support. So we're really trying to show in our reports that there is a way of finding the relationship between physical health and mental illness.
Hey, what about for yourself, Jason?
Yeah, hopefully listeners took away the integrated approach to mental health. So whilst most large employers already deal a lot in the mitigate illness by providing things like EAP, we also need to think about how do we prevent harm from occurring in the first place by using a risk management approach and using education. And then also, what are the things that we're doing in the design of work and the skills and health promoting things that we're doing at work in relation to policies and activities that promote employees' ability to flourish using PERMA.
Okay, and what about for yourself, Juliana?
Yeah, so I guess the key point is really to know what we're talking about when we talk about mental health. To be clear, are we talking about stress? Are we talking about mental disorders? And then the second, not just relying on EAP programs, to solve all the mental health problems that employees might have, but really take responsibility and really think about, the people who suffer from a mental disorder, and make sure that we help them to get the right treatment.
Brilliant. Well, thank you so much for kind of summarising those takeaways for us. We've got time for just a very, very brief Q&A session. So, Jason, I've got one for yourself. What do we do as an employer in markets where there is considerable resistance to employer intervention in terms of sort of like employee health issues in general, particularly if it's mental health? So how do we stand?
Yeah, well, I think the big thing in relation to that, Sophie, is we've identified you need that culture of trust. And there's a number of ways to build that. I mean, first of all is identifying the people who are really going to drive this within your business. And down at the employee level, who are your champions? Who are the people who are going to promote the activities that the company is organising in this space? And, you know, sharing with people why they should be involved. But transparency is key. And once you've identified your champions, you can actually show them, you know, the level of data that you're collecting and how you intend on using it. And then they can hopefully talk to the broader employee base and hopefully alleviate any concerns about participation.
Fantastic, thank you so much, Jason. So we've only got time for one question today, but if there have been other questions that have been sent in, we are able to follow up with you guys yourselves afterwards. So just thank you all for listening, and a special thanks goes to Jason from People Diagnostics, Juliana at Generali Health Solutions, and Daniela at Generali Employee Benefits for a truly interesting exploration of managing stress among global workforces. We will be sending out a couple of recordings of the webinar in due course, and if you would like any further information, please endeavour to get in touch with ourselves at HR Grapevine, and we can follow up those with Generali in due course. So have a great afternoon, and we look forward to welcoming you back to additional webinars in future. Thank you.